Well, first of all, thanks everyone for attending. Last time I looked, it looked like we had quite a few on there, and I tried to skim through the list a little bit. And I did recognize a couple names, so that's nice. So the objectives were kind of flashed up there as we were getting started, but hopefully when we finish this presentation, you'll have an understanding, or maybe a better understanding of disease transmission routes, be able to maybe recognize the basics or recognize signs of illness and what you should do if you notice that one of your animals becomes sick. Define biosecurity a little bit and explain why it's important, especially when you travel with your animals to shows or anywhere else that you bring animals together that are from different places and you congregate with them. You should be able to describe things that you can do to keep your animals healthy before, during, and after a show or any other type of exhibition, and explain how you obtain and the importance of a CVI, or Certificate of Veterinary inspection, or as most people think of it, a health paper. So how is disease spread? Well, most of us understand and the most common route we think of is the direct contact. That's when that one animal that's potentially sick or that's harboring disease comes in direct contact with another animal. So we think of it as nose-to-nose contact, or one animal coughing or sneezing, or even in people, right? We all kind of get this after the whole COVID thing. But there's also indirect contact, meaning that the animal comes in contact with something else that has been contaminated in one way or another. It could be a waterer, it could be a feed pan or a feed bin. It could be a syringe and needle or something like that, or even maybe a shovel that you used in one pen to move manure and now it's in another pen. So there's a lot of ways that disease can be spread. Orally, the animal eats or licks something and then, and spreads those germs or leaves those bacteria or those viral particles on that object, and then another animal comes up and licks it. We spread aerosolization, or spread just through the air. We most commonly think about this in cold and flu season when people are sneezing or coughing. And this was, again, talked about a lot during COVID. If you just think about part of the reason we wore masks, right, was because of the aerosol spread. Vectors, ticks, biting insects. Sometimes we have blood-borne parasites in many, or diseases such as anaplasmosis always comes to mind. It's more of a disease in the south, but it's moving north, and that's usually taken in by a tick or a biting insect that draws blood and can be transferred to another animal that way. Some of the signs of illness, we talk about lethargy, or the animal just not acting right, acting lethargic. Another way to look at that is inactivity. It's just not moving like it typically does. Right now with avian influenza going on, that's one of the things that we're looking at. And one of the questions we ask, are those birds moving? Are they just kind of wanting to sit still? Are the feathers all ruffled? Do they have swollen eyes, wattles, those kinds of things? Is the animal lame? Do you see swollen joints? Do they seem painful when they're walking? Is that on all feet, one foot? Is it just the front feet, just the back feet? Those kinds of things. Those are all important things to think about when you notice something's not right with your animal. Feed and water intake, another one right now. Avian influenza is on my mind because that's what we're dealing with, but that's one of the early signs in that disease is a reduction in water consumption. But we see that also sometimes in other diseases in other animals, where we think about bovine respiratory disease, for example. The first thing I think about is the animal backing off feed. Diarrhea, that's another sign that we see sometimes with the avian influenza virus, but we could see this with some bacterial infections that we see in calves. Is there a nasal discharge? Most of you that have cattle, for example, or even pigs, they get up in the morning, they might have like a clear, more serous or watery discharge from the nose when they first get up in the morning, that may not be a problem. It's when that gets thick and ropey and maybe more cloudy in appearance or kind of greenish yellowish in appearance and it's thick, then that's a change and that's abnormal. Do they have watery eyes? Are they getting pink eye or do they have pink eye? Are you seeing skin lesions? Are you seeing sores, rounded raised areas, blisters, those kinds of things? Or sometimes we just hear that they're ADR, or they ain't doing right, or they just don't look or act right. And many of you that take care, you take care of your animals on a daily basis, you can usually tell if the animal's just not acting normal. And sometimes that's enough. Maybe you just want to watch it a little bit more after that, or watch it a little bit closer. These are some pictures with just some things that we're looking for and or some common things. So very important, if you look at the picture on the far left with the circles on it, those are depicting blisters, or as we call them, vesicles. But a vesicle is just a fluid filled, like a blister, just like if you burned yourself, or sometimes if you get sunburned bad enough, you can get blisters. But these blisters show up, and the ones that we're really concerned about can show up on the feet, the coronary bands, on the hooves, between the toes, also around the muzzle, the snout, and those areas. And we're worried about those for vesicular diseases, such as foot and mouth disease. The next picture to the right is the picture of, should be a sheep or a goat, and it has ORF or sore mouth there. Those are things we're concerned about, and we're concerned about those because those can also be zoonotic. Zoonotic means it can be passed from the animal to the humans, and they can get little blisters as well. The next picture to the right and slightly lower is the picture of a neck of a sheep, and you can see those kind of roundish raised areas there. That's called club lamb fungus. In some of our other animals, it's known as ringworm. And then those pigs that are up in the upper right corner, they have some pink purpley ears and maybe some blotchy skins. That could be a number of things. A lot of times, if there's some septicemic disease, you can see that with salmonella. You could see similar things, maybe a little bit more skin lesions if they have erysipelas, but you can also see that with something like African swine fever. So all of those types of things can be concerning. So let's move on to biosecurity. What is biosecurity? Well, biosecurity is a series of practices that's designed to prevent the introduction and or spread of pathogens or disease to your animals or from your animals. So think about it like this. Having good biosecurity practices can help keep your animals safe and healthy. So we want to use good biosecurity to help keep diseases off of our farm, but we also want to keep it from spreading someplace else, or from our premises, maybe that's the way I want to put it. And so some of those practices are restricting the movements of animals, people, or things, maybe restricting visitors, getting a history of where visitors have been. Right now, and especially, African swine fever is in the back of our mind, as it was diagnosed this past year in the Dominican Republic, which is not that far away. But people that have traveled out of the country, especially, I would say out of the country at all, but especially if they've been to an area that has things like foot and mouth disease, African swine fever, classic swine fever, avian influenza, you probably do not want to let them on your premises. They could be carrying something on their clothes, shoes, something else that they could spread to your animals. Another good one to think about is rabbit hemorrhagic disease. That can also be carried on feed equipment, boots, those kinds of things. I mentioned equipment, other animals. Wildlife is a big one. Sometimes that's hard to exclude wildlife, but when we have, say, a swine confinement, we want to do our very best to try and keep the wildlife out, to keep them from spreading disease. We know that some of these diseases can be spread by mice, rats, birds, other things like that. And as I mentioned earlier, stop diseases from spreading to other areas. We want to keep them from spreading to our other populations. As an office, the state veterinarian's office, the Iowa Department of Agriculture, Our main concern is the protection of all the animals in Iowa. And so if we find an outbreak of something or a highly contagious disease someplace, our job is to try and keep that from spreading across the state to other populations that are susceptible. If you have sick animals, it's a good idea to isolate them. What does that mean? Well, it could mean different things on different farms. And that could mean having a sick pen that's separate from your other healthy animals, making sure that they're, that if it's an older animal, that they don't have contact with calves, because calves would be more susceptible to some of those diseases. For example, if it was a bovine. Isolate your new or returning animals. What does that mean? Well, there's a lot of people that put quarantines in place, and probably should. If you buy a new animal, there should be some kind of an acclimation period. You're worried about not only that new animal that you purchased bringing a disease that your animals are susceptible to your animals and making them sick, but you could also purchase an animal that has not been exposed to something that your animals have, and your animals do not get sick from it because they have immunity built up, but a new animal does not. So acclimating them over a period of time so they can develop some immunity is good. And so keeping them isolated, feeding them separately, a lot of times people will ask, how long do you do that? Well, depends on what you're trying to protect against. I would like to see you be able to isolate those animals when you come and go for 30 days. Right? I talked earlier about if you go off to a show and come back, when you take your animal away and go to an exhibition, you have now exposed them to all the animals that are at that exhibition. They could pick up something. A lot of diseases don't show signs right away. They have an incubation period. And so that incubation period could be a week. Some, depending on the disease, could be 30 days. I think it's EIA can go up to 50 some days, I think, which is equine infectious anemia. So some of that's depending on what disease you're trying to protect against, on how long you want to have that quarantine. Most commonly, we see somewhere between 14 and 21 days of isolation, which would be great. But then there are people that go to shows and they may go to shows every week. You need to be really cautious there, because you're constantly moving and exposing your animals to other animals that could be sick or could be harboring disease or incubating a disease. And you're also vice versa. Those other people at the show, you have to worry about your animals. Have separate boots, clothing, between pens or between groups of animals, or between, if you just have, maybe you only have a few animals and you take them to shows. When you go to the show, you have separate equipment that you use at the show, maybe grooming equipment and feeding equipment, and you don't use that for your animals at home. Again, anything you can do to cut down the likelihood that you're going to transmit disease. And it's a good idea not to share equipment between yourself, and maybe you have a friend down, that's also at the show, and you're using the same feeding equipment or grooming equipment. Probably not a good idea, just in case. You want to try and protect your animals and everybody else's. We decided to put this slide in there just to remind everybody that at this time, there is a ban on any live bird exhibitions. So anything that's going to bring a bunch of live birds together into one setting, and that's because of avian influenza. And the way that this proclamation reads, or this document reads, is that there will be a ban on the live bird exhibitions until 30 days after the last detection of avian influenza in Iowa. So if you have questions about that, this is on our website, and also don't be afraid to call us and ask questions. I did not realize how many people brought pigeons to Iowa to fly back someplace else, but we've had a lot of calls here recently about people asking if they can still bring their pigeons to Iowa. The answer, no. All right. Planning to show your animals. Think about which shows you're going to attend and who else is going to be there. When are you going? What do you need to bring? And again, I think that it's a very good idea to have separate grooming equipment, separate feeding equipment, and other supplies. And even though you have those separate items, it's a good idea to make sure that you clean and disinfect them when you leave the show. It's a good idea to do it before you leave the show grounds. Because if you do it at home, there's a chance that you just take the disease home and then clean it at home and you still have it there if something would get on your equipment. Other things to think about is if you need to vaccinate something before a fair or a show, or you need a health paper, always check with your show superintendent. We have rules in Iowa, and you can go to the Iowa Department of Agriculture website and see the rules for exhibition within the state of Iowa. That tells you the basic rules that are required to exhibit an animal in Iowa. Exhibiting means any show, any place where you're going to bring animals together. 4-H, FFA, jackpot shows, any of those things would be an exhibition. So you can find those requirements on the IDALS website. But there's also some shows that have special requirements. The Beef Expo always comes to mind in the fact that they require brucellosis vaccination for all the females sold there. And so they can be a little bit more strict. So always check both. Keep your animals healthy. Make sure they have their vaccines. I think about cattle and bovine respiratory disease. I want to make sure that I vaccinate them for that. Or swine, erysipelas, because that seems to be, especially state fair time, that's the perfect time, it seems, to have a spread of erysipelas. And then some of the respiratory vaccines as well. Parasite control is another one. If they're, not only can parasites spread disease, but they can weaken the immune system of your animal and make them more vulnerable to other things like respiratory disease or influenza or something else. As far as the health requirements go, one of the big ones in the state of Iowa is a Certificate of Veterinary inspection. If you're traveling to another state or you're traveling within the state, in most cases, you need to have a Certificate of Veterinary inspection or a health paper. There are some exemptions within the exhibition rules for the state of Iowa. And again, that's something you want to check with your superintendent about to see if they actually require the health paper, or in some cases, like for 4-H at a fair, if they have it arranged to have a veterinarian inspect all of the animals upon arrival at the exhibition, they do not have to require a health paper. One of the things that people ask about is, why did I have to get a health paper when nobody looked at the health paper? You don't get the health paper for somebody to read it. You get the health paper so that that animal has been examined before they ever leave the farm, so that hopefully we can find them at the first sign of disease. And the earlier that animal that's detected, the more likely it is that we can stop the spread. But you also have to, so the other question is, why would you require a health paper and require an inspection at the show? Well, as I mentioned before, you have variable incubation times on diseases. So you could potentially have somebody examine that animal. If we find disease early and then prevent it from going to a show and passing it on, that's great. But there's always the opportunity for that animal to be harboring a disease that was undetectable early. And so again, having somebody look at it upon arrival is good. It can seem like a pain in the neck for some of the exhibitors, but if you have another animal that gets exposed to something because it was never looked at or because it was missed, then you might be upset. So I know it can be trying at times, but think about it as protecting your animals and protecting the industry as a whole and all the other animals there. And as I said, there's a website link down in green there that takes you to the current requirements, or at least our web page. We're going to talk about identification and have some examples coming up, but it's very important. One of the things that's required for all exhibitions in Iowa is that the animal have a USDA individual official identification. And we'll talk about how to determine that here shortly. Certificates of veterinary inspection, at least in the state of Iowa for our exhibitions, we do have some caveats to that. Number one, swine, we require that Certificate of Veterinary Inspection, that health paper be completed no more than 7 days prior to the date of that start of that show or when you arrive at that show. And that's because in most cases, the incubation period is a little bit longer than 7 days. So if we can look at that 7-day period, we can be more confident that animal does not have African swine fever, for example. For sheep, it's 14 days. So you shouldn't have that health paper signed or have that animal inspected by the veterinarian any more than 14 days before you arrive at the show. For everything else, for all the other animals, at least at this time, it's 30 days before the show. Remember, as we stand right now, there is a ban on poultry exhibitions. It's always a good idea to plan ahead and make an appointment with your vet. When I was at ISU, we would start to get calls to have health papers written for like county fairs, probably about 3 to 4 weeks prior to the fair. And we would start to set up appointments so that we could kind of group people in different areas of counties and then hit a bunch of people one right after another. But please don't wait till the last day. If you're going out of state, the state of destination or the state that you're traveling to makes the rules on what needs to be done for your health paper. And so you need to have your vet call the state of destination to figure out what those requirements are. Again, do not wait till the last minute. Sometimes they require testing, and testing can't be done overnight. TB testing is a good example. TB testing takes a minimum of 72 hours. So don't think about it on Friday and say, I want to travel on Saturday if your animal needs a TB test. As I mentioned, identification. Cattle require official identification on each animal. Swine also require official identification for each animal. Ear notches are no longer considered official ID in the state of Iowa for exhibitions, just like we don't recognize brands as official identification. Excuse me. Identification numbers must be written on the tag, and it's not just, or on the CVI, excuse me. It's not just that the number needs to be, it needs to be the entire number. The biggest, when I'm at the state fair and I'm looking at health papers, the biggest mistake that we see is not having the entire ID on the health paper. So if we look at this first tag on the left, you see the US shield in the upper right corner. You look at all three of these tags, each one of them has the US shield on there. That signifies that that's an official ID tag. And so if they have the US shield on there, it's an official tag. So you don't have to worry about the official part. Now we get to the whole entire ID number part. So if you look at the first tag on the left, you see there's big numbers there, 6250, right? But above that, it says IA, JKB, that IA and that JKB and that 6250, those are all parts of that ID. If you think about it as the IA is the first name, the JKB is the middle name, and the 6250 is the last name, all parts have to be on that Certificate of Veterinary Inspection or that health paper. So when your veterinarian's writing that health paper, always look to be sure that the entire ID is listed on that health paper. So in this case, the health paper would have to say IA JKB 6250. In the middle tag, it says FFA on there. It has a US shield above the FFA. This entire ID number is 840-003-147-836-462, and then the 295. That's a lot of numbers, but all of those numbers have to be on there. The same thing when you look at the RFID tag that's on the far right, that orange tag. It says 840-003-224-758-395. Again, it has a US shield, but all 15 of those digits have to be on that CVI for it to be valid. If they're not on there and you show up at a show, that CVI has been signed by the veterinarian. You cannot add them. That's a signed legal document. So you cannot change a signed legal document. The veterinarian could rewrite a health paper or could potentially add it and do some things to make it. It's probably best if they rewrite it, or if that can't happen, a veterinarian at the show could rewrite a health paper. So again, when you go to a show or when you get that health paper from your veterinarian, make sure that the entire thing is filled out and make sure that all digits or letters or alphanumeric representation of that ID are written on that CVI. I can't stress that enough. For sheep and goats, most of the time they're going to require a scrapie tag or a tattoo. Those are both can be official IDs. If the tattoo is registered as the scrapie identification with USDA, then it can be an official ID. So make sure that it's a registered tattoo. Things for poultry is they have to come from a Plorum typhoid clean flock, or have had a flock test within 90 days of the show. And again, as I said before, I can't stress it enough because it's the number one problem we see with health papers is all of the numbers on that tag or letters have to be on that CVI. Only bring healthy animals to the show. If you see an animal and you don't think it's right or you don't think it's healthy, don't try and sneak it through to the show. You're risking everybody else's animals that are there. You're risking getting kicked out of the show. A good example is at the Iowa State Fair every year. I cannot remember a year where we haven't had a sheep that had some clum lamb fungus or something else. If you travel a long ways to get to a show and you have to turn around and take an animal home because it's not allowed in the show, that can create extra stress and extra angst on everyone. So it's probably best if you notice that the animal doesn't look quite right or you think it's sick, don't try and sneak it through. At check-in. So what happens if you don't have a CVI or it's not correct? In a lot of cases, if there's a veterinarian at the show, they can rewrite a health paper. The problem comes if there's some type of testing that's required to get into the show. That can't always be done. So make sure you understand. What happens if the animal looks sick? If it looks sick, then the veterinarian at the show should turn it away and send it home. That's not fun. That's not fun for any of us. I've had to do that before, and it's not fun. So if you can pick it up before you ever get to the show, and that saves you some time and less stress. The other thing it does is it's less likely that you've carried something to the show that could be passed on to other animals. There are specific things that are written in the exhibition requirements and in most show documents or most show catalogs or with the superintendent, and things that are not going to be allowed. Warts, ringworm, foot rot, pink eye, any type of draining wound or abscess, club lamb fungus, which is really ringworm, sore mouth, and any other infectious or contagious type of disease. Again, if the animal's sick, it probably should stay home. When you get to the show, continuously monitor your animal for signs of illness, especially if it's a longer show or it's at the exhibition for a longer period of time. If you see other animals that look sick, report them to the fair, report them to your superintendent, report them to somebody else that's in charge at the fair, or find the fair veterinarian or the show veterinarian and report it to them. Visitors, again, the state fair is a good example because you get millions and millions of people through there, right? And the animals are in pens and they want to go by and touch and feed things and do other things to the animals. It's okay if you say, please don't, but be nice. I mean, it's a good time to try and educate the public on what you're doing with your animals, educating them on the animals, educating them on diseases and those kinds of things. So if you have time, take a couple minutes. Don't just chase them away. And if we chase them away and not treat them very well or not try and educate them, sometimes other things happen, and sometimes we don't, that doesn't shed a good light on us and livestock in Iowa. So we want to try and promote livestock in Iowa and how we're doing a good job with it. Other exhibitors, that means, again, at a lot of these shows, there's pens and there's nose-to-nose contact there. So watch the animals next to you as well as watching your own animals. And we talked about sharing items a little bit ago. We talked about sharing equipment. Again, you can see how important that is because it's been in here 3 or 4 times already. I'm trying not to mix animals from different farms. I know sometimes it's really easy to, and we see this a lot with different 4-H groups that will load up all the 4-H. Maybe they come from a small 4-H club or an FFA club, and they load up all the animals from that club and bring them together. Just always remember that you run the risk of, if you have a disease or one animal comes down with something, you run the risk of giving it to the rest of the animals in that trailer or on that truck or wherever. Try to avoid, we talked about visitors and letting them touch the animals. Just remember they can carry something on their hands, on their clothes, on their shoes. Be vigilant about removing manure and bedding that's soiled from the pens. Try and keep your feed in sealed containers so that rodents and other pests don't get into it that can also carry disease. And as I mentioned before, this is a perfect opportunity to educate the public, not just on disease transmission, but having worked as a vet at the state fair for numerous years, some of the things that you overhear is those of you that show pigs and you have your little show stick, or I don't like to call it a whip because that always gets a bad connotation, but a little whip thing, and you're using it to guide your pig. I've heard people say before, why do they have to whip the pigs? Again, use that as an educational opportunity to let them know that's not what's happening. Explain it to them a little bit, especially if you overhear something like that. Just think about, those animals. Another thing that causes stress is traveling. So animals that go from show to show to show, at some point they get overly stressed, and they are more susceptible to contracting some disease. So just remember, if you're traveling from one to the other, watch those animals a little bit closer. Those are animals that should especially be taken care of, looked at close, and make sure they have appropriate feed and water and vaccinations. Pay attention to the weather. Is it really cold out? I don't know. In Iowa right now, I don't know if we can even predict what the weather's going to do, but it could snow again. Maybe it will, but hopefully not the state fair during county fairs. But pay attention to crowds, pay attention to the weather, hot, cold, all those kinds of things. And again, we talked about cleaning and disinfection. I can't stress that enough either, that if you're at a fair or you're at an exhibition, clean your feed bowls and everything else before you load them up to take them back home. Try and think about, how can I keep them the cleanest and leave whatever I might have come in contact with where I was and not take it home. When you get home, you can unload your animals, and we talked about isolation. Clean and disinfect your trailer, or any pens that you had animals in. Clean your boots, clothes, and like I said, some people will even have separate boots and clothes that they use when they go to exhibitions. I don't think that that's a bad idea. When you get home, isolate the animals. We discussed this earlier, that we're at the show. How long? That's always a question, right? I would always, when I was in practice, recommend 14 days. 21 days is probably better. If you could do it for 30 days, that'd be even better. Some of you are probably rolling your eyes right now that, how am I going to do that for 30 days? But you should do it at least for a period of time. 14 to 21 days, it would cover a majority of diseases and incubation periods. If you have sick animals or animals that just returned from an exhibition that you have separately, It's always better if you're going through and doing chores to do your home animals first and then save those sick animals for the end, or any animals that have traveled for the end, just in case they are harboring something. You're not going to take it back to your animals that are on the home place or at home and that have been healthy. What do you do if you do find a sick animal? Well, number one, report it to somebody, whether it's your veterinarian. That's always a good first step. Maybe you see something that looks like some blisters around the mouth of one of your animals. The best thing to do is call your veterinarian and have them look at it. If they think that it's something that needs to be investigated further, they would call us. You can always call IDALS as well, or USDA. We have veterinarians throughout the state that can go out and do a foreign animal disease or infectious disease inspection on those animals and take some samples. If we are performing a foreign animal disease investigation, it doesn't cost you to have those samples taken and submitted to the lab for that thing that we're looking for. So for example, if there was blisters and we were taking samples for a suspected foot and mouth disease, that test would not be charged to you. We want to, again, like I said earlier, we want to protect all the animals in the state of Iowa. Plan ahead for shows. Know what the health requirements are. Know whether you need a health paper. Know whether you need any certain vaccinations or testing or anything like that. Have your equipment ready. Clean it before you go. Clean it before you come home. Watch your animals for signs of illness. If they look sick, don't take them, please. Biosecurity, biosecurity, biosecurity. It's much easier to try and prevent a disease from entering our farm or entering our livestock than it is to try and deal with it after the fact. Other things that I think I can mention is don't be afraid to call Iowa Department of Agriculture, your local veterinarian, USDA veterinarians. There's a lot of really good information out there on the USDA APHIS site on biosecurity. If you're a poultry owner, the Secure Poultry and NPIP programs have some great biosecurity information. There's a link to the IDALS website that you can see right there on the screen. There's some good information there on cleaning and disinfection and biosecurity and foreign animal diseases and those kinds of things. And again, if you have questions, please contact us.
Our first question is, we're planning to hatch chicks at our fair as a learning experience. Is that allowed?
Right now, no. Kind of depends on when your fair is, but as I said, it depends on when your fair is and where that would be in relation to the last diagnosed case of avian influenza in the state. So remember, if it's 30 days or less since a diagnosed case, then there would be no exhibition, and that would include hatching chicks. Okay, so the next question, I was afraid this one would come up. All right, so the next question is, state fair tags do not have a U.S. shield this year. Do exhibitors need a tag with a U.S. shield in order to exhibit at fairs? The short answer to this is yes. There's some confusion on this tag thing, and I have to talk to Dr. Kaizen, who's our state vet, and see where we're at with that, because I think that they were talking to some of the state fair people about to the 4-H people about this. It's the 4-H tags that there was some confusion on, and I can speculate on some of that, but I can't really tell you an answer to that right now. I'm sorry, but hopefully that will be out there shortly. Somebody else asks, is rabbit hemorrhagic disease a problem in Iowa? We have not diagnosed a case in Iowa yet. There's been a case in South Dakota, at least one in Minnesota. I'm trying to remember, I think Nebraska, but I can't remember for sure. So it's a concern because it's in the wild rabbit population. Right now, it's not a huge concern. We haven't diagnosed one in Iowa, not to say that it can't happen. We have tested some rabbits that died unexpectedly or that got really sick and didn't, that could potentially have been that disease and have not come up with it yet. So we are looking. If you have a rabbit that shows signs and symptoms, especially if you have just bought some new rabbits and brought them into your group of rabbits, herd of rabbits. I never know what I'm supposed to call them, but and then something like this happens, please reach out to somebody. But right now, it's not a problem. It could be in the future. The way that that disease is moving, I think we're going to end up seeing it endemic, which means just naturally occurring in our wild rabbit population. Is there still, I think that's supposed to be shortage of tags. So last I heard, Ernie, they're catching up. And you're probably referring more because of the swine tags, because I know that at least we have a stockpile of cattle tags in the basement, RFID tags, but they tell us that they're catching up. So you probably know better than I do. Alicia from the Iowa Poultry Association posted, and she's right, there's a list of pullorum testers that can be found on the iowapoultry.com website. And she reminds everyone that registration is open for the PT blood testing school, which I think I did a recorded webinar kind of thing for them last year. So you'd have to look at my mug again if you went through that. But they have some good information and some good links on their poultry website. This question says, my child is going to show in an open jackpot swine show around our county. Are they required to be tagged? Yes. All swine in exhibition need to be tagged, and they're supposed to be tagged with an official ID tag. How do you go about getting your tags? You can call your veterinarian and you can get the tags from your veterinarian. That's probably the best way to go about it. So there's different types of official ID tags. Most people, especially with pigs, are familiar with the plastic tags, but you can also use the metal tags in there as long as they have the US shield on them. I'm not quite sure unless that's related back to that chick question, which probably must be about the last week in July. So the best thing we can do is keep an eye on the avian influenza. Their USDA has a website where you can keep track. If you go to the USDA APHIS website and go to animal health and then go to avian, scroll down just a little bit and you can click on avian influenza, and it gives you a list that you can sort by state or by date. If you sort it by state and then look through it, it can tell you the last date of a confirmed test for that state. And that's pretty helpful. And so if you ever wonder about moving animals within Iowa, if it's to an exhibition, look at the exhibition requirements. I have to refer to them quite a bit. You can also on that same site go to, there's a listing there of what it would require if you wanted to import animals into the state. So remember, we regulate animals coming into the state of Iowa. If you were moving animals to, say, Wisconsin, you would have to meet their requirements. So you would need to contact them. Is a fluffle a rabbit? Yes, it is. I just decided right now.
What about a bird display at the fair, specifically parakeets? We have a display for people to go inside with parakeets and handle them.
At this time, if you're bringing together a group of birds, it is not allowed.
And then there was one more question, biosecurity question with poultry. If we're unable to have a show, our meat birds still need to get to the processor. Can we tailor all the birds together?
That's a good question. If they're going to the processor, that shouldn't be a problem as long as, and there's going to be a lot of little ifs in there probably. So depending on where you're at and what time, when it is. So if you would happen to be in a control area, then you would not probably be able to. And so the way avian influenza works is if you have an infected premise, you draw circles around that premise and the first circle goes out. I can't remember, it's like 3 miles, but the big one is 10 kilometers for the control zone. And so if you're in that area, you're not just going to be able to move animals in and out. You'd have to be permitted for some of that movement. And so that could throw a monkey wrench in that. Otherwise, if we're through this avian influenza thing, you could probably, because they're going directly to slaughter, you could probably take them all because they're going to slaughter. So the likelihood of them transmitting something between each one of them before they're slaughtered is pretty low. Hopefully that made sense. The best thing to do is, as you get closer to that time frame, is call us or call your veterinarian, and we can answer that question better at the time.